Sawadee and good afternoon. We're back again with the English language summary of the live press briefing from the Center for COVID-19 Situation Administration, or the CCSA. And today's briefing is for Wednesday, the 15th of September 2021. And I will be summarizing some information just delivered by Dr. Tawisin Wisanuyotin, the Deputy Spokesperson for the CCSA, just now. And I'll also be providing some important updates for our international audience. Now let me start with an update on the number of vaccines that we have administered since the start of our national vaccine campaign in Thailand. So yesterday we administered 694,076 doses of vaccines. And therefore, this will increase the accumulated number of vaccinations nationwide now to over 41 million doses. So within that number, 228,352 people have received their first jabs yesterday, and 464,749 people have received their second jabs yesterday. So you can see that the number of people receiving their second jabs now exceed the number of first jabs. So we are inoculating people to complete their doses as soon as possible. And in terms of the number of people, we now have the total number of people who have received at least their first dose of vaccines standing at 27.7 million people. And people who have received their second dose now are 13.2 million people. And of course, this number also includes the expatriate community in Thailand. In Bangkok, we are progressing very well with our vaccination drive because almost 96% of the residents in Bangkok have already received at least their first dose, and 38% have received their complete dosages of 2 doses of vaccines. Now moving along, I'd like to talk about the new confirmed cases that have been reported today, standing at 13,798 cases, and this is on a downward trend. The number of active cases now stands at 128,546 cases. And of course, only a number within those active cases are being treated in medical facilities, and the rest are being treated in hospitals or field hospitals or community isolation centers. Now, the new recoveries today stands at 14,133 cases, and it's a good number to report that it also exceeds the number of new confirmed cases. New fatalities today has been reported at 144 cases. Regretfully, most of the cases had suffered from hypertension, diabetes as the number one cause of death. And on this note, I'd like to reiterate the importance of pregnant women. We'd like to raise awareness that pregnant women are particularly vulnerable to COVID-19, and we urge for those who are pregnant to get vaccinated as soon as possible. And for the public, if you see any pregnant women who need help, to access vaccines or even to access public health services, please do not hesitate to assist them as much as you can and bring them to vaccination venues as soon as possible. Now, today there were some observations at the CCSA operational meeting this morning about the number of cases found in Bangkok again. Bangkok appears to have the highest number of infections today at 2,788 cases, and followed by the usual suspects, Samut Prakan with 1,351 and Chonburi with 835 cases. And the reports of the new infections continue to decline steadily. Most of the new infections are still, however, detected in factories, in markets, in workers' campsites, in office places, and among family members where we maybe practice less caution. So it's important to note that since last week, the number of fatalities appears to be on a downward trend, and the majority of fatalities are still people in the high-risk groups, those who are elderly, aged 60 and over, and people with the 7 underlying diseases or medical conditions. And 80% of fatalities are still to be found in high-risk areas. Now let me give you some updates on the progress of procurement of some additional COVID-19 vaccines. The Thai government will soon be procuring 449,500 doses of AstraZeneca vaccine from the European Union via Spain. And the vaccines are expected to arrive Thailand by the end of September. So this is a very fast and good deal that we will receive very soon. And also next year, the Thai Red Cross Society and Julapon Royal Academy will import at least 9 million doses of Moderna vaccines as a booster dose. And this project is funded by the government and is counted as part of the government vaccine campaign and will therefore be offered free of charge. Now, there have been questions about whether foreigners who hold tourist visas, whether they are eligible to register for COVID-19 vaccines in Thailand. And I'd like to respond to this particular inquiry by reiterating that international tourists who wish to travel to Thailand are already required to be fully vaccinated before they enter Thailand, and therefore they should not require vaccination while they are vacationing in Thailand. And also because we still do have limited vaccine supplies and we have specific plans for each of the vaccines that we receive, and therefore there are not enough vaccines to support vaccination for tourists right now. However, we will continue to vaccinate foreign nationals living in Thailand on a long term. So these individuals who are currently possessing a non-immigrant visa for various purposes, so these are people with non-immigrant visa for different purposes, such as people who are working under a government service visa or employees working for some companies in Thailand, business people who are doing trading or investing, students or even teachers, or those who are undergoing various types of educational training schemes, or foreign media, and those traveling for religious purposes, researchers and experts. All these people who are holding non-immigrant visas are eligible to register for vaccination in Thailand. And also, very importantly, migrant workers are also entitled to and included in our vaccination campaign. So these are all the foreign nationals living in Thailand who are eligible to register for our vaccine in Thailand. Now I'd like to talk a little bit more about long COVID, because this is very important, and it's been reported in many countries, and also the WHO has been talking about long COVID for some time now. And our own Ministry of Public Health has reported that in Thailand we have about 10 to 20% of COVID-19 patients who are suffering a post-syndrome that we call not long COVID. So these long COVID symptoms are being experienced even after they have recovered from COVID-19. So long COVID will display symptoms of fatigue, of muscle pain, headaches, and depression, and these may occur from the body's reaction or side effects and drugs administered to the patients during treatment. And some conditions can linger beyond the period of treatment. There are also other factors that increase the prevalence of long COVID symptoms, such as age, obesity, and daily steroid use. And as statistics have shown, the symptoms will take about 6 months to a year to recover from, but of course this will differ from each individual. However, these symptoms can be alleviated by vaccines, and people who have received COVID-19 vaccines have less chance of getting long COVID symptoms, and as the vaccine provides protection against such long COVID symptoms. And therefore we'd like to stress that everyone should get vaccinated as soon as possible. So before my briefing ends, I'd like to respond to some more inquiries about the plan to reopen additional provinces to international arrivals on the 1st of October 2021, and this was also mentioned by Dr. Tuwisin just now. Well, I'd like to elaborate that the CCSA will still need to discuss and approve public health and disease control measures, as well as standard procedures to support this policy. And as there are many logistical aspects also involved with this scheme, we understand that this information is important to many international friends who want to plan their travels to Thailand in the near future. So I would recommend for you to wait until the CCSA has announced our specific guidelines very soon, and we will provide further updates and information on these important guidelines as soon as the CCSA has approved them. We are considering these recommendations based on assessments from our experience with managing the Phuket Sandbox scheme in the past 2.5 months that this scheme has been in operation. Phuket has unfortunately encountered some local transmissions, but due to our very elaborate plans and the competency of the Public Health Administration, we have been able to control the spread of the virus very well, and we will draw any valuable lessons from these past couple of months. Of course, there are many important factors that also will be taken into account, particularly the capacity of the healthcare system should any new outbreaks occur. So in the past 2.5 months, we've seen over 32,000 international arrivals in Phuket, and only 91 persons from international arrivals, or about only 0.28%, were found to be infected with COVID. It's a very low percentage. However, we still have found quite a high number of local transmissions, and therefore we need to control and find lasting solutions to to solve these problems before we reopen the country in targeted provinces later on. So therefore, allow me to highlight once again that as we are seeing a downward trend in both the number of new infections and the number of fatalities, and as some businesses continue to reopen, we must continue to practice and follow health guidelines and personal hygiene for our own safety. And that's all I have for you today. Thank you very much for your kind attention. Stay safe and have a nice day. And we will be back again with another update on Friday. ขอบคุณค่ะ สวัสดีค่ะ